New money hits the Ebola response the same day Canada starts screening people at the border. One reads like confidence, the other reads like a hedge. If you're just joining, response financing has been the fault line in the Bundibugyo response. Before this round of pledges, the picture already included Chinese emergency support, European research money, and a senior U.S. delegation that spent July 11 through 15 in Uganda, reviewing border screening, surveillance, lab capacity, and logistics.
This is Ebola Watch. 13 million from the AfDB, another 2.5 from China, and Canada's now got Ebola measures at its own border. We start with what that Canadian policy actually asks of travelers.
If you want to keep up with Ebola response financing and partnerships, tap follow so the next episode lands in your feed.
From Ronald Owili at Kenya Broadcasting Corporation.
3 members of the East African Community, EAC trade bloc, have secured $13 million, $1.7 billion, from the African Development Bank, AfDB, to help in the fight to contain the spread of Ebola virus disease. The grant by the bank will enhance national emergency responses to the deadly virus in the Democratic Republic of Congo, DRC, South Sudan, and Uganda.
So, the African Development Bank is putting $13 million into this. And here's the number that stopped me. 11 million of that goes to DRC, but Uganda and South Sudan each get $1 million. South Sudan. That name hasn't been anywhere in the coverage this week.
And that's the detail worth sitting with, Daniel. $1 million to South Sudan doesn't tell us South Sudan has confirmed cases. It could just as easily be preparedness money. The grant covers 3 countries. It doesn't prove there are 3 active fronts.
That's what I want nailed down, because the framing is, the outbreak's reach has spread. AfDB's own words. If a listener hears that and pictures Ebola crossing into South Sudan, are they right, or are they ahead of the facts?
Ahead of the facts, I'd say. The dollars are being placed along a corridor. The case map hasn't moved with them. And look at the plumbing. 10 million routed through WHO, 3 million through Africa CDC. So the financing piece now has real dollar figures attached, from AfDB and, as we'll get to, from China.
Which is progress. 3 days of watching the machinery agree there's a plan and no dose ready to ship. Now at least there's an actual amount behind the plan.
Here's Daily News Egypt.
China has provided an additional $2.5 million in emergency funding to the Africa Centers for Disease Control and Prevention, Africa CDC, to strengthen efforts to contain the ongoing Bundibugyo Ebola virus disease outbreak in the Democratic Republic of the Congo, DRC, and Uganda, as regional and international health agencies intensify measures to curb the spread of the virus.
So this is China's second check. Another $2.5 million, bringing them to $4.5 million total, straight into Africa CDC. Sarah, the $13 million from AfDB we just walked through goes broad. This money goes to one body.
Right, and it's earmarked, which matters. Surveillance, case management, lab services, logistics, community engagement, those are the exact frontline functions. We're not talking about a general fund.
Here's what I want to know. Africa CDC set its own emergency roadmap with named deadlines a few days back. Source tracing was on that list. Does new cash mean those deadlines are funded now, or is the plan still out ahead of the money?
Honest answer? A dose of caution. Funding a line item and executing it in a place where a treatment center got attacked are 2 different problems. The money can move faster than the access can.
That's the part that nags me. You can wire $4.5 million to Africa CDC overnight. You can't wire security into Bunya.
No. And the statement names surveillance and case management for both DRC and Uganda. But a lab tech in Butembo needs the logistics line to actually reach them. A commitment in a press release isn't a reagent on a shelf. This one's from Public Health Agency of Canada.
In response to the ongoing Ebola disease outbreak in the Democratic Republic of the Congo, the Government of Canada is taking decisive action and implementing new temporary border measures to reduce the risk of the disease entering and spreading within Canada. As of Monday, July 20th, 2026, 11:59 p.m. EDT, any foreign national who is in the Democratic Republic of the Congo within the past 21 days will be prohibited from entering Canada.
Here's the one that actually touches an itinerary. As of tonight, 11:59 EDT, any foreign national who's been in the DRC in the last 21 days is barred from boarding a flight to Canada. Full stop. Visa or no visa.
And it's broader than the DRC. The suspension names the DRC, Uganda, and South Sudan. Approved visas don't get you around it, running through August 28th.
So, after 3 days of watching the money lag the outbreak, the first wealthy non-African government to formalize screening isn't betting on containment holding. That's the tell, right? You don't slam the door if you're confident it's staying in the East.
I'd be careful. PHAC still calls the risk to Canadians low, and there are 0 travel-related cases. The policy is precautionary. But Daniel, you're right that it answers a question the funders can't. Canada doesn't believe geography alone is protecting them.
And the UN advised against exactly this kind of ban. Echoes of past outbreaks. Does a border wall contain the disease, or just push travel underground where you can't trace it?
That's the cost. A 21-day bar keeps people out of Canada. It does nothing for the nurse in Butembo, and the AfDB and China dollars we covered earlier are still chasing a response that's only as good as its access.
If you count on Ebola Watch for quick public health updates, you might also like Food Recall Watch, daily FDA and USDA food recalls, plus allergy alerts, outbreak-linked notices, retailer polls, and pet food advisories. Find it wherever you listen to podcasts. Next, we're watching Canada's temporary suspension. It's scheduled to run until August 28, 2026 at 11:59 p.m. Eastern, with related arrival measures in effect until August 29. You'll find links to every story from today's briefing in the show notes, so if one caught your ear, that's the place to read further. That's Ebola Watch for today. This is a Lantern podcast.